Our Trudy, if you could introduce today's speaker for me, please.
Thank you, President Danny. It's my pleasure to introduce Trudy Emojong. Gertrude, she's Gertrude, so she's my namesake. Trudy and I went to school together at university in Uganda at Makerere University, and we pursued a Bachelor's of Mass Communication. That's where I met her. And she's remained one of my favorite friends, very close friends. A person I'm very, very proud of because of, who she is, both professionally and outside her profession. She's currently the marketing and communications professional, the communications lead for Afripads. Afripads is an organization. She will tell us a little more about it, but they deal with reusable sanitary towels, and they do a lot of work. They're one of the organizations that have supported the initiative that we're running back in Uganda. Trudy is a youth leader, a global youth leader, and a person who's very passionate about menstrual health and hygiene. And one of her passions is to really advocate and ensure that people in areas that are very impoverished learn to really fight period poverty. So it's my pleasure to introduce you to this club, Trudy, the Rotary Club of North Scarborough. You're very welcome, and we are hoping that your conversation will speak to everyone here, and we'll learn a thing or two about menstrual equity in Uganda and in Africa as a whole. I believe that the members of this club are very, eager to learn more about menstrual hygiene and health, especially in Africa, and to know that the support that they have given to our project and will be really valid to bring change or cause change in the community where we are serving. Thank you, Trudy. And Danny, is this the part where I ask her to go ahead, or do I bring it back to you?
Right. So Trudy, take it. I said, great.
Thank you, President Danny and Gertrude, Trudy, my namesake, for that wonderful introduction. I'm really, really honored. Before I dive in, I have to apologize. I don't have the best internet connection, so bear with me if I drop off during this conversation. But nevertheless, I will do my best to keep logging back in. So thank you so much to the Club of North Scarborough for inviting me here today to share with you about my passion for menstrual health and hygiene. The honor is really mine. As I was earlier introduced, my name is Gertrude Adekir Emojong, but I am more popularly and affectionately known as Trudy. I am based in Kampala, Uganda, and I am a proud Pan-African. I am the National Marketing and Communications Lead at Afripads. Afripads is a social enterprise which was established in sub-Saharan Africa in 2010 with the goal of overcoming key challenges that women and girls face whilst on their period in relation to access, affordability, and sustainability of menstrual products. Since the launch in 2010, we have become the world's leading social enterprise manufacturing reusable sanitary pads. However, we have a unique approach that goes beyond the product, where we also provide education and data collection tools. I'm also a human rights advocate and a menstrual health and hygiene champion and enthusiast. My passion, interest, and professional background led me to pursue a master's in public health to better understand the challenges faced by the developing world, Uganda in particular, in terms of global health, access to healthcare, communication that is youth-centric, and creating spaces that are youth-friendly within the healthcare system. So much so that the youth especially are the ones who bear the brunt of a poor healthcare system, and all this piqued my interest for menstrual health and hygiene. I would say that my interest was really born when I noticed the plight of young women and girls in Uganda who resort to unsafe methods to manage their menstruation. Methods such as getting a mattress, removing pieces of foam from the mattress, toilet paper, leaves, getting an old dress or an old cloth, cutting it up into rags and using that. And this is just within Uganda, but these unsafe methods are replicated all over sub-Saharan Africa. Not only are they unsafe, they're also uncomfortable, they're unhygienic, and they limit a girl's natural activities such as going to school, playing, because there's a real fear of maybe I may stain, maybe it may leak, and I'll be ashamed in front of the boys, in front of the men in my community. So all this, seeing this situation really made me interested in menstrual health and hygiene. Even before I came to Afripads to do this work as national communications lead, I was genuinely interested in the public health situation of Uganda. Traditionally, in African traditional society, we had a way of managing our healthcare, which was very communal and brought people together. But with the onset of globalization or colonization, some of those methods were lost. Menstrual health was not traditionally seen as a taboo, but became it as we lost some of our beliefs and we lost some of our practices and how a grandmother or the elderly females would share this information and welcome the younger generation into womanhood. Excuse me. So it was very important for me to really understand these challenges and how these challenges affect girls in particular. In 2020/2019, the COVID-19 pandemic broke out, and that made most of Uganda, most of Africa actually lose the gains that they had made in the menstrual health and hygiene space, because women and girls who traditionally before could afford and access period products could not because of the pandemic. According to a report by Plan International, on any single day during the COVID-19 pandemic, 800 million women and girls, I repeat, 800 million women and girls are menstruating and grappling with the unique challenges of the pandemic. And that will be the focus of today's discussion, is just how the COVID-19 pandemic has really affected menstrual health and hygiene in Uganda. Recently, an organization called WOMINA is an evidence-based organization that really focuses on public health and health outcomes, did research in Uganda to investigate the MHH-related challenges during the COVID-19 pandemic. And some of their findings were shocking from their dipstick survey. The first finding was that there was difficulty in accessing menstrual health and hygiene products. I am cognizant that you are in Canada. In Uganda, what happened was the government imposed a national lockdown. And that lockdown meant that there was no movement. The transport system was limited to a few people who were able to access government stickers or were moving commodities or essentials. The schools were closed to enable the children to go home to be safe, and so forth. And this lockdown led to unique challenges, the first one being accessibility. Women and girls who could afford to buy themselves period products just could not access it, because it meant, how do I move from my home to a shop or to a supermarket to buy much needed supplies? There was no public means of transport, and even the private means were limited. So more women and girls who previously, before the pandemic, could afford and could not access pads, could not access any kind of MHH supplies. In addition to the challenge of accessibility, there was the challenge of the products such as pads, tampons, cups, etc. Their prices were increased because of a breakdown in its supply chain. Since the government had imposed that lockdown, it meant that even businesses, their supply chains were disrupted. And what was on the market was all that was left. It was the market, and people didn't understand. People didn't know when or how they'll get more products. Therefore, pushing up the price of an essential, such as menstrual health and hygiene, causing more women and girls to plunge into period poverty. In addition to the increased prices, there was also an increase in gender-based violence during this period, May 2020 up until now. There was increased gender-based violence. Currently, we're in the 16 days of activism against gender-based violence across the world. And what came out strongly during the lockdown and the COVID-19 pandemic in Uganda lockdown was gender-based violence, because households were faced with the harrowing decision, poor households. Do we buy food or do we buy pads? And this caused friction in marriages, in homes where we live in a patriarchal society, and the man is the head of the home, and he is the key breadwinner, and he decides on the budget and what's essential and what's not essential. And you have poor women and girls who need these supplies, but because they're in this situation, they're unable to afford it themselves and are relying on the family head to buy this. And so we saw an increase in gender-based violence during this time. Additionally, we also saw many women lose their jobs, or those who are able to hold on to their jobs had to accept pay cuts during the lockdown, further exasperating already difficult situation. So in totality, women and girls faced the challenge of accessibility, affordability, gender-based violence, and so forth. So during this time, in these few months of the lockdown, Uganda lost many gains that we had made in the menstrual health and hygiene space. Prior to 2020, the Ministry of Education and Sports had set up a menstrual health and hygiene management steering committee, which I am a member of, and had recognized the 28th of May as Menstrual Health and Hygiene Day, which is celebrated nationally, and had encouraged schools to have emergency supplies, had created a menstrual health and hygiene policy which guides schools on how they engage with pupils, how they engage with teachers on menstrual health and hygiene, and made several recommendations, such as having emergency supplies at each and every government school. Now, because of the lockdown, the girls were sent home. And whilst they were home, they were unable to access those supplies. And even the education that they would have received from the schools, the menstrual health and hygiene education, which had become part of the sexual and reproductive health rights education in school, they were unable to receive that support. So sadly, many of them actually dropped out of school. And because they dropped out of school, they couldn't fulfill their potential. It also led to other vices, such as an increase in teenage pregnancy and an increase in early child marriages. Further exasperating a situation, there's a quote from one of my colleagues in the MHM steering committee that I love using, where he mentions, "We are all result of a missed period. If our mothers had not missed their periods, none of us would be here." Therefore, menstrual health and hygiene is everybody's business. It's not just a woman's business or a girl's business. It's something that touches all of us. And it's beyond just supplying pads, tampons, etc. It's also about the support. It's about the education, and all this needs to come together to ensure that the menstrual health and hygiene situation actually improves. When I am in discussions with people, often men will ask, why should we care? It's something that doesn't affect us. And I love to use a simple example of, if we enable girls to fulfill their potential, they are more productive to society. It means that they will continue with their education up to the highest level that they feel is good for themselves. They will be better mothers because they're more informed, they're more educated, and they will be productive to society. So it has a snowball effect. Because a girl doesn't have supplies today, doesn't have education, doesn't understand what's going on in her body, menstrual health and hygiene education, she will opt to not go to school. And when she opts to not go to school, we are leaving her to be prey to other vices. We are setting her up for teenage pregnancy. We're setting her up for an early marriage. And we're setting her up for a low income. We're setting up her children for early childhood deaths. It's just a snowball effect. It seems something very simple. I mean, it's just a pad, it's just a tampon. How can that really have this snowball effect? So we call upon men. I love to see that the strong presence of men in this forum to actually support menstrual health and hygiene, because it's something that really also matters to you. Men are the policymakers, men are the fathers, the brothers, the uncles, whatnot. So even in your own sphere, in your own home, in your own family setup, it's important that you have the education and you have the awareness about menstrual health and hygiene. And even in your workspaces, in your professional spaces, it's important that you support the women in those spaces with your knowledge, with your time, with your resources, because it's something that affects all of us. Over half of the world's population are women, and a good percentage of those women menstruate. And it's something natural and normal. The United Nations has actually recognized it as a fundamental human right. But there's only so much. It needs implementation. We all deserve to be treated with dignity, with respect, because we're human. And this human right should not be overlooked because it affects women. It also affects men in small ways. One of the key policy changes that needed to come out of the COVID-19 pandemic was it was not seen as any supply. There's a very sad image of a supermarket in Southern Africa, which slapped a notice on the pads aisle that mentioned, this is not deemed essential, therefore do not purchase. This is during the pandemic when people were being rationed and told you have to purchase this. A large supermarket chain in one of the most developed countries in sub-Saharan Africa deems menstrual health and hygiene supplies as a non-essential. You can only imagine the magnitude of the problem, where key policymakers don't see it as an essential for a girl's well-being in school and see it as a nice to have, not as a must have, where we're leaving these girls in a very vulnerable situation. There have been several studies that have shown that first, these girls drop out of school. They spend 3 to 5 days of the school term. The school term in Uganda is about 3 months, 3 to 5 days of every month during the school term out of school. With time, they eventually give up and drop out of school. And studies have shown when they drop out of school, they become pregnant at an early age or get married at an early age to escape their predicament, which is just a terrible situation for the nation, where we already are grappling with a high teenage pregnancy rate of 20%. And we are increasing this with this COVID-19 pandemic and the aftermath of it. So in totality, I call upon everybody to fight period poverty. It's not just a woman's issue. It's not just a girl's issue. We all have to fight it and to normalize discussions around menstrual health and hygiene, normalize discussions in our homes, not just in our professional spaces, but also in our homes. Because as the saying, charity begins at home. I also call upon people for greater collaboration. I'm very happy to be here and see the interest from this Rotary Club in menstrual health and hygiene, because as that African proverb says, if you want to go fast, go alone. But if you want to go far, go together. So we need everybody to come to the party, to come to the discussion, and to do their bit. And with that, I will close and say that together we can really overcome period poverty. Thank you.
Yeah, Trudy, that was absolutely excellent. I'm looking at that.
The project.
Excellent. Yeah.
Yeah, I'm looking at that number of 800 million. That's staggering. And living in Canada and living in Scotland before, it really is not something that I thought about at all, because it wasn't a problem where I am, right? But it's really enlightening to hear you talk about it. It's quite staggering. So we are doing some work with Trudy, which seems like so little, but we are doing something, and maybe if we can get other people to do something as well. But it seems to be a government thing, mostly a government thing. And I have no idea how you would change a government's attitude when a major store will say that those products are not essential during a pandemic. It's incredible. Yeah. Does anybody have any questions for Trudy? Arthur?
You know, even though it's 2021, this subject is a little bit of a taboo in many countries. And how easy is it to speak about this in Uganda and bring it into focus for people to understand it needs to be addressed? I would like your opinion on that.
Thank you, Arthur. Danny, can I respond to them as they come up?
Yes, please.
Okay. Thank you, Arthur, for that question. You raise a very good question. That's where menstrual health and hygiene education actually comes in. In Uganda, there are many damaging misconceptions around menstruation, which have really stifled the conversation around it. How we have approached it is to actually include male champions, because most of the stigma actually comes from the men, and it stems from ignorance, where they don't understand what's happening and they don't understand what they need to do to support women and girls. We've also lobbied with other champions in the government, for example, the Menstrual Health and Hygiene Management Steering Committee, which is embedded in the Ministry of Education and Sports, where they are trying to normalize the conversation by actually having a policy where they're discussing it in the schools during the biology lessons and also during the life skill lessons with both the boys and girls. So that we're grooming a new generation of men and women who find it normal to talk about periods. So that's one. I would say it really boils down to education. When people understand, they're less likely to spread myths and misconceptions, and they're less likely to stigmatize women and girls who are menstruating.
Yeah.
To respond to Danny earlier on, yes, 800 million seems like a very big number. And it's worldwide, it's global. It's not just isolated to sub-Saharan Africa or Uganda, it's globally during the pandemic in 2020. So Canada, Afripads has also worked with a wonderful organization in Canada called Hygiene, formerly Hygiene, now called Period Isle, where we've developed menstrual health and hygiene curriculum and education around this. And Period Isle has also engaged the Canadian government to start the conversation around periods and whatnot, especially in the Indigenous communities in Canada, where it's a big subject. Thank you. Any other questions?
Yeah, Trudy?
Yeah, mine is not like a question. It's more of a compliment to what Trudy just said. Actually, I would like the club to help me thank Trudy, because when we started that project back in the community where we're working, she was one of the people I thought about. So I told my team of Trudy, and she really did a good job. She lobbied on behalf of our organization to her organization, Afripads, and they gave us the first big donation of 300 sanitary towels, which helped us help 300 girls for a whole year. So they didn't have to think about, sanitary material for a full year, thanks to Trudy. And Trudy, I would like to also help me thank the Rotary Club here for the donation that they made recently. So the last purchase we made at Afripads was courtesy of the Rotary Club of North Scarborough. And for that matter, on behalf of the team at the Menstrual Project in Uganda, I'm really grateful to both you, Trudy, and Afripads, and to this Rotary Club that continues to really hit the call to help fight period poverty in Uganda. So thank you so much, Trudy.